Yo, guys, like we Africans need really innovative interventions, otherwise we have a full-blown crisis in our hands. I just finished reading this study, this paper from a research group in Amsterdam. I did my research with them, an internship with them, so I'm familiar with the research they do, and they do a lot of work with trying to show health trends among migrants. So they study populations like the Ghanaians living in the Netherlands, compare that to Dutch people, compare that to Ghanaians living in Ghana, rural Ghana, urban Ghana, sometimes also compare it to like Turkish and Moroccan populations based in Amsterdam. And they just released this study which shows the prevalence of hypertension and how that progresses over years. So like how the high blood pressure increases in different populations. And some of the, like, I'm going to make a more in-depth video about this, but some of the percentages I'm seeing here, plus 50% of people having hypertension in this study. It's like, that means if you take two people, any random two people somewhere in urban Ghana or rural Ghana, it's like one of them is going to have hypertension. Take into account how expensive it is to treat these things. Take into account how low the awareness level is of like the things you can do to prevent it and what you can do to help it, like exercise, your weight, and all those kind of things that play a role. These numbers are quite concerning. They're quite concerning. And the thing is, normally you'd be like, yeah, it's urbanization, all the bad food and sedentary lifestyles. But no, this study says even in the rural areas of Ghana, where we previously thought the risk factors were, there's more active lifestyles and blah blah blah. No, even those areas are affected. 50+%, which is also in line with other studies that have been done on the continent. So it's not just Ghana in this case. Studies in Nigeria have shown similar results. Studies in South Africa have shown similar results. I think it was Malawi also. Bro, we're on the highway to having a full-blown hypertensive crisis. I did my internship in Ghana at some point, Tafo General Hospital in Kumasi there. The hypertension and diabetes clinic, when they had it on Thursday, that line was reaching outside of the hospital. Like, that line was long. People were waiting there hours because they needed to get treatment for hypertension and diabetes. And these are things which we ignore until it's so late, where there's a lot of stuff we can do to prevent these things. Man, these numbers are alarming, bro. Sheesh. Yeah, we gotta do better. We really gotta do better. If we don't innovate about this, yeah, not looking good. Not looking good at all.